Hello again. Now let's move on to Module 2 with a special focus on mask use in healthcare settings. This module addresses mask use in healthcare settings and is intended for healthcare workers. The learning objectives of this module are to discuss the masks that are recommended for the care of COVID-19 patients, to describe what mask use is needed in each transmission scenario, and to explain the mask use for community health workers. This module is intended for health workers and public health professionals such as infection control specialists and those advising on mask use in healthcare settings. Before diving into masks in healthcare settings, let's recap the transmission scenarios. The first being community transmission, in which the majority of cases are locally acquired and widely dispersed in the previous 14 days. Within this scenario, there are also 4 levels from low, moderate, high to very high transmission. The second is a cluster scenario, where cases are limited to a well-defined cluster linked by time, geographic location, and common exposures. The third is a sporadic scenario, where cases are imported and sporadic or linked to sporadic cases, and there is no further locally acquired transmission from them. This implies minimal risk for the population. The last being the no-case scenario, in which there are no detected cases in the previous 28 days. This is, of course, in the context of there being a robust surveillance system to detect them. Before we begin speaking about masks, let's talk about hand hygiene for a moment. Hand hygiene is recommended frequently, but is especially important in healthcare settings where pathogens responsible for causing infection are easily transmitted from the environment to patients on health workers' hands and equipment. In order to limit the amount of infections in a hospital, we recommend always cleaning your hands before entering a patient environment and before touching them, before clean or aseptic procedures, after contact with bodily fluids, and after touching a patient or their surroundings. In the context of mask wearing, we recommend cleaning your hands before touching your mask for any reason, whether it is to adjust it, put it on, or take it off, and after you have touched the mask, we recommend you clean your hands again. For the care of COVID-19 patients, there are clear instructions on what type of personal protective equipment, or PPE, should be worn. Health workers caring for or in the settings where COVID-19 patients are must wear the following personal protective equipment: a medical mask, unless you are performing an aerosol-generating procedure or you're in the room during the time of the procedure. Then we recommend a respirator. This should be accompanied by eye protection, such as goggles or a face shield, a gown, and gloves. The medical mask, as well as any other personal protective equipment, should be discarded and changed after caring for any patient who requires contact droplet precautions for COVID or any other pathogens, of course followed by hand hygiene. If the mask becomes wet, soiled, or dirty during this time, it should be changed as it is no longer efficient. During the time it is on, the medical mask should not be touched, either for adjusting or displacing it from the face for any reason. If this happens, the mask should be safely removed and replaced and hand hygiene performed. In health settings, in areas of community or cluster transmission, universal masking is advised for anyone entering the health facility. Universal masking, in this case, is defined as the requirement for all persons, whether they are staff, patients, visitors, service providers, or anyone else entering the building, to wear a mask at all times, except, of course, when they are eating or drinking. Health facilities in this instance refer to any primary, secondary, and tertiary care level facilities, including outpatient care and long-term care facilities. Inpatients in these health facilities are also advised to wear masks when they are around others and are coming into contact, and physical distancing of at least 1 meter cannot be maintained. This is typically when patients are outside of their rooms or care areas. In a sporadic transmission scenario, health workers and caregivers working in clinical areas are advised to wear a medical mask continuously during their activities and throughout their shift. Staff in non-clinical areas without direct exposure to patients, such as administrative staff, do not need to wear a medical mask during their routine activities. Patients, visitors, service suppliers, and other staff are not required to wear a mask unless the risk assessment deems it necessary, or unless they are themselves sick with any COVID-like symptoms. In a transmission scenario where there have been no reported cases of COVID-19 in the past 28 days, health workers, staff, patients, and visitors are advised to wear a medical mask only according to standard and transmission-based precautions, and when a personal risk assessment deems it necessary. For community health workers or those working in outreach settings, they are advised to continuously wear a medical mask in scenarios where there are any type of spread of cases, such as community, cluster, or sporadic transmission scenarios. Regardless of the setting you are in, don't forget to follow the 5 basic public health measures in order to lower your risk of getting infected with COVID-19 and infecting others. These are keeping your physical distance of at least 1 meter from others, cleaning your hands frequently, practicing respiratory hygiene when you do have respiratory symptoms, wearing a mask when appropriate, and ensuring the adequate ventilation. This slide shows a number of mask resources and videos that are available on the WHO websites. You can also find out about the correct way to wear personal protective equipment. You can watch a video, you can download posters, and you can use the WHO Academy mobile learning app to look at a PPE course. This brings us to the end of Module 2. Thank you for watching, and if you are interested about mask use in community settings, please proceed to Module 3.